The honourable member for Tyndall Park.
Thank you, Honourable Speaker. I've been hearing from my constituents in Tyndall Park that almost 7,000 publicly employed allied health professionals represented by the Manitoba Association of Healthcare Professionals are fighting for a competitive contract. Allied health professionals here in Manitoba are committed to delivering frontline quality care to Manitobans every day. They are problem solvers and innovators who continue to dedicate so much to our province. Why is this government choosing to risk a strike instead of prioritizing healthcare workers in Manitoba?
The Honourable Minister of Health, Seniors and Long-Term Care.
I thank the member for that really important question. I want to reassure Manitobans that there are essential service agreements in place to ensure that critical and essential care is provided. But I also want to be clear that our government has continued and will continue to be supporting employers to be at the negotiating table so that collectively bargained agreements can be in place. We've successfully seen that happen, and we're encouraging the same outcome in this situation. I understand as the health minister that after 2 terms of a previous PC government, healthcare workers are frustrated. They had their wages frozen for 2 terms of a conservative government that didn't care about them. We're working to change the impacts of that. We're going to keep listening to them and pushing for a good outcome in terms of collectively bargained agreements in this case.
Great job.
The honourable member for Tyndall Park.
Thank you, Honourable Speaker. Allied health professionals are integral for our healthcare system. They increase the accessibility of care, they help patients to heal and regain mobility, they promote mental wellness and healthy lifestyles, they provide support for Indigenous patients who are in locations outside of their home community, and they provide invaluable work in emergency rooms and other frontline areas. Yet, Honourable Speaker, even after this government promised that they had a plan to help, support for healthcare continues to decline. Why does it appear then that no action has been taken to avert a strike, which could happen as early as tomorrow?
The Honourable Minister of Health, Seniors and Long-Term Care.
Honourable Speaker, I can assure that member that work is happening. We know that parties are at the negotiating table working very hard to have a positive outcome to this process. As a government, we've made significant investments. Beyond the 1,255 net new healthcare workers, we've made sure that we have 7-day-a-week allied healthcare professional support across the healthcare system so they have more flexibility on the front lines, better work-life balance, and can provide care at the bedside of Manitobans. Again, after 2 terms of a PC government that disrespected them, didn't engage, fired folks from the front lines, we know we have a lot of work to do, but we're going to continue to do that work to the benefit of all Manitobans.
The honourable member for Tyndall Park.
Thank you, Honourable Speaker, and I do appreciate the remarks from our health minister. But members of the Manitoba Association of Healthcare Professionals, they include paramedics, respiratory therapists, speech-language pathologists, physiotherapists, social workers, lab technologists, perfusionists. They're all part of 40 specialized allied health professionals. Can the minister please share with us what work is happening specifically with the Manitoba Association of Healthcare Professionals?
The Honourable Minister of Health, Seniors and Long-Term Care.
Again, I would reassure that member that parties are at the table. We know that their teams are there communicating, and we're all encouraging folks to stay at the table and to come to an agreement that workers will be satisfied with. You know, and I say this as somebody who worked on the front lines as a nurse, shoulder to shoulder with allied healthcare professionals. We have a tremendous amount of respect for them. We know the value they bring to the bedside of Manitobans, which is why we've made investments to add more to the front lines, to continue to listen to them, and to make sure they have a better work-life balance.
Now they love the minister.
We're going to continue to support these processes moving forward, and quite frankly, do the work of repairing the damage that was done over 2 terms of a failed PC government that didn't care about healthcare workers then and certainly doesn't care about them now.
Great job.